My name is Sherry Guess, and this is the Heavily Meddled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome to the jungle. Thank you for coming back to this edition of the Heavily Meddled Podcast. Today, we have our guest, Jen Lofgren. She is joining us to talk about Chiari Malformation, which I know very little about, but we're going to learn all about that. And I'm excited to have her on. This is the first Chiari Malformation segment I've had on the podcast, so we're excited to learn more about that.
Thank you so much for having me.
Thank you, Jen, for coming on. From beautiful North Carolina. Is it beautiful today, Jen?
Really hot, but yeah.
It's really hot. I posted a meme to somebody the other day who's a friend of mine in Greece, because everybody knows I've been going to Greece. And I was like, something about warm breeze. And it had a picture of the warm breeze. And it was like this fire, like blowing a skull.
That's what it feels like. So crazy.
No, forgive me. I don't know geography very well. North Carolina has beach, yes?
Yeah, about 2 hours away from the beach.
Okay. Today we're going to talk about something that is completely new to my wheelhouse, but something Jen's been dealing with for a long time. It's called Chiari Malformation, and she actually had metal implanted in her brain. Before we even get into the medical stuff, tell us a little bit about you. Tell me a little bit about who you are and what your life is, what you do for a living, about your family, what you like, what you don't like, your hobbies. Tell me a little bit about Jen first so we can know who you are.
Sure. So I am a wife and a mother. I have 2 teenage daughters. I did move from New York. So I was born and raised in New York. I did move down here about 3 years ago, which complicated my medical journey. I have 2 beautiful doggies, and I'm currently on disability and doing better, but still have some things going on. There's really not much more about me. I'm pretty simple.
Were you from upstate New York or like from Manhattan, like the city?
We would say upstate, but everyone would be like, don't call it upstate. So about an hour north of New York City in the Hudson Valley. It was beautiful. I loved growing up there, but New York just wasn't the same. So we got out of there around COVID, a little bit after COVID.
Yeah, that was a hard time up there. The coldest I've ever been in my life was in Albany. I was over in Canada and Montreal, and they came over Lake Erie. I like cold, but it's so cold off that lake.
Yeah, even where I was, it gets pretty cold. So I'm very happy to be down here. One of the reasons I did move is to get in warmer climate for my health. It also makes me feel better. I think it makes everyone feel better when it's sunny and warm. I had a vitamin D deficiency for a long time.
A lot of people have that seasonal affective disorder and they get really down in the winter. And my brother, he lives in the Pacific Northwest and he's like miserable in the fall. Like it is gray all the time. We never see the sun all winter. Poor guy.
Exactly.
What did you do before you went on disability? What was your career path like?
I worked in a bank, credit union. I just did accounts and loans and retirement stuff. I loved what I did. When everything started getting real bad, it became so difficult. Then they put me in a call center doing the same thing, but oh my goodness, that was even worse. Like the brain fog, I would be in tears someday because I just could not collect my thoughts. And it got real bad.
So Jen, go back to the beginning and tell us a little bit about what Chiari Malformation is, how many people have it, how common is it? Pretend this is Dummies 101 because I literally know almost nothing about Chiari Malformation.
Yeah, no problem. So I knew nothing about it either before I was diagnosed. I had never heard about it. About a year after my first daughter was born, I had a very traumatic birth, very bad birth story, but it's a whole other topic. I was really sick that year following. And about a year after, I noticed something was really wrong. They thought I had MS because I had a lot of lesions. I did an MRI and the whole workup. And so they were working me up for that. They ended up doing a spinal tap on me. And after that, it was even like tenfold got
What kind of symptoms were
terrible.
you having? Because you said you had a lot of symptoms. Were these symptoms
Oh,
of Chiari
everything.
even then before you even knew what it was? And what were those symptoms?
Yeah. Mostly it was like disorientation, brain fog, headaches, terrible headaches, vertigo, eye pain, sensitivity to light, all the things. It sounded like MS. And that's why they saw the lesions and they were like, let's do the whole spinal tap. So the spinal
Okay.
tap just put me over the edge at that point. So I continued down the journey trying to figure out what it was because they ruled out MS with the spinal tap, that I continued to get worse. And probably about 2 years of just back and forth testing, I got another MRI and they were like, we're going to send you to a neurosurgeon just because we really don't know what's going on. And immediately the neurosurgeon was like, did anyone tell you have this Chiari malformation? I was like, what is that? So, of course, I go home after that and I'm Googling and I'm joining Facebook groups and I'm learning about it. And I'm super scared because all of a sudden I'm learning I'm going to need brain surgery because that's just what kept coming up. So I got sent to a specialist in New York City at a very well known hospital.
Let me stop you for one
Sure.
second and ask you, before we
Mhm.
go on to the specialist and more the journey, tell me what Chiari malformation is. What is
Sure.
it?
So, Chiari malformation is essentially a malformation of your skull mostly, which pushes your brain tissue down into your spine. So, you
Okay.
have this area at the bottom of your skull. It's an opening. It's called the foramen magnum. I can never say that right. It's the hole that
Okay.
the spine goes through to
Okay.
connect to your brain. And brain tissue is going through that hole and it's not supposed to. It's supposed to be up above that a pretty good amount. When you have Chiari, it's called the cerebellum tonsils.
Say that one more time. Cerebellum what?
Cerebellar tonsils. I don't even know if I'm saying that.
Tonsils. Boy, that's a tongue twister. Say that three
Yes,
times fast.
I can't
Cerebellar
say.
tonsils. Cerebellum tonsil. That's terrible.
Exactly. Just the wording of these things is crazy.
Normal people with
Find
a
out about
clear
it.
brain can't say this, let alone somebody with a brain injury, which is what it is, or
Exactly.
chronic brain condition. If you're able to say that, you get a lot of extra brownie points in my book.
I know. I avoid it. I'm like the lower part of your brain.
The hole there that your brain's coming through.
Yes.
Sorry to
And
the
if you
medical
just say
community for
no,
butchering anatomy and butchering biology.
yeah, it's okay because they have problems too. Seeing doctors and nurses just have issues with the pronunciations of these. I don't feel
Yeah,
too
right.
bad.
50% of doctors graduate in the bottom of their class. It's probably the ones that couldn't pronounce this.
It is, yes. So I could say tonsils because it's part of the brains, the tonsils. They are like these little stringy things, I guess, at the bottom of the brain. Mine goes below, pushes onto the spinal cord. They say it's crowding, and crowding also means herniated. There's so many terms. So all that, it's herniated, it's crowded, it's pushing into my brainstem, my spine. Generally, when you have Chiari malformation, that's your problem because the fluid in your brain, it's called CSF fluid.
Yes.
It's what bathes the brain and keeps it all nice and buoyant.
A lot of people with POTS have a lot of
Yeah.
trouble with CSF. And I know that I have Tarlov cyst disease, which is a connective
Mhm.
tissue disorder, and it causes cysts in the spine. But a lot of people I know with Tarlov cyst disease, this may be totally irrelevant, but I think it could be relevant. They're urged to not have epidural steroid injections and epidural injections because of
Yeah.
CSF leaks. Is
That's
that
true.
a common concern with Chiari?
Yes, very
Is that
much.
CSF is the cerebral spinal
Yeah.
fluid that runs up and down the entire spinal cord. I've had spine surgery and I had to have a myelogram CT, and also with Tarlov cyst surgery because they're accessing the spinal cord. They require you to
Mhm.
lay flat so that you don't have a spinal fluid leak. You have to lay flat. For my Tarlov surgery, it was 2 days. For the myelogram, it was a few hours. You have to lay completely flat and still. And if you get up too early, you'll have the spinal headache, which it may be as common with Chiari too, and you have to have a blood patch if that hole
Mhm.
doesn't seal. And that is the worst headache I've ever had in my life, y'all.
It's funny, you know so much about it. That's a whole other connector to all of this comorbidity. But yeah, absolutely. All
So,
that.
so let's unpack this in an order that will make sense to the listeners. So, Chiari malformation is how common?
Oh, goodness. When I was diagnosed, they said it was like 1 in 1,000.
One in a
Now they're
thousand.
thinking it's about 1 in 100. In 10 years, that's how far we've come with awareness. People are getting more MRIs done. Oh,
Going
I
for a
mean,
cervical MRI next week. I should ask them if I have Chiari. I don't need
yeah,
another diagnosis, but it would be nice to know.
Mm,
That's pretty statistically significant to go from 1 in 1,000 to 1 in 100. So that means it's pretty
yeah,
common. So I may be putting words in your mouth here, but if it is that common, is everybody with Chiari symptomatic or not necessarily?
no, that's
Okay.
another whole thing. The small percentage are actually symptomatic,
Do you know
and
the
that can come
percent?
from trauma. It's not a whole lot though. It's like more people are walking around without knowing they have it.
Okay. What makes it become symptomatic?
Trauma, mostly it's trauma,
Physical
spinal
trauma,
tap.
mental trauma, both?
I believe mostly physical. I wouldn't be surprised if mental trauma brings it out too, because your brainstem and your whole nervous system could probably activate it, but it is mostly from physical trauma.
Did you have a car accident? Did you some other kind of accident or
Yeah.
fall? What triggered this for you?
It was the birth of my daughter. I had that really traumatic birth with her, and I also had the epidural. Epidurals are known to bring it out. And that's why they say for us, we're not really supposed to get epidurals or spinal taps
So the
because
trauma
when we're
doesn't have to
told,
be to the head or the brain area or the neck. The trauma can be
yeah,
anywhere on the spinal cord that exposes or traumatizes the spinal cord and that fluid.
that's a good way of putting it.
Wow.
Having any type
Okay.
of traumatizing the spinal cord in any way, that car accident, yes, hurting your neck in a fall, whiplash. There's so many different types of
Interesting. So is it
trauma.
considered related or is it considered a connective tissue disease?
It's related to connective tissue. I don't know if you ever heard of Ehlers-Danlos,
I'm
EDS.
suspected to have EDS. I'm not formally diagnosed,
Really?
but we suspect that I have it, although we don't know what form. I'm not super, super bendy like this way. I'm
Hmm.
not bendy at all. That's as far as I get, but my spine and
Yeah.
my hips, my pelvis are very bendy and like I can hyperextend a little bit
Oh,
in my
that's, yeah.
elbows. So I don't know
Yeah.
what form. I don't think it's HEDS, and maybe I'm wrong. I have yet to add that, but yeah,
Hmm.
Ehlers-Danlos is common with Tarlov cyst, with lipedema, which I
Yeah.
also have, and now with
Yeah.
Chiari. So it's such an interesting symptom picture. How many of us are walking around with EDS and all these comorbidities that could explain so many
Mhm.
things, and just doctors are not up with the EDS spectrum, for lack of a better way to call it?
Right. No, it's true. And that's why you have to go to these specialists that they recommend you go to. You don't just go to any neurosurgeon. You don't just go to any spine doctor. Once you get to getting on the track of what you might have, they say find that type of specialist so that they
Okay.
really can break it down to you.
Yeah, so let's go back to your specific story. So you get told you have this Chiari
Mhm.
malformation by this neurosurgeon. Then
Yeah.
what?
So then I went to a specialist after I went in the groups. I was told, go to this Chiari specialist. He's the best. He was in New York City, top 10 surgeon for Chiari. And immediately he tells me, you need surgery, but we'll do more testing just to make sure. So I go through more testing with him, and I am like, I'm never getting the surgery. I'm sorry. Nope. I don't care what
What's involved with the
happens.
surgery? What do they do?
So now I know a lot more, obviously, but at the time, all I knew it was brain surgery. What they do is that there's different ways of doing it. The most minimal thing is taking some bone, taking bone out of the skull, like shaving around that hole, making that hole bigger where
Okay.
the line goes through, to give the brain more room to just not be so crowded. And they also take not the whole thing, but some of the C1. So that's the most minimal thing that you can really do.
Let me ask you for a second. So if you open the hole and make it bigger, and the problem with Chiari is brain tissue coming through the hole, doesn't that make more room for brain tissue to come through the hole?
No, because it somehow expands. It's
Okay.
sad. You would think I would know more. They take the bone so the brain has more room. But that's what I was supposed to have. They did more. When they went in there, they were like, there was so much more going on. So the other ways of doing this type of surgery, it's called a duroplasty. And
Okay.
you can either shave down the dura, which again, they just somehow make more room because of its crowding, and they put a patch. So that's another way of doing it, or they just go in and open the dura. But the best way to describe it is when you are letting out like the waistband of your pants. Compare it to that. Like you put a patch there.
If you're trying to give more room in your waistband, you expand the waistband.
Exactly.
Okay.
And they put a
principle.
patch there. So they do the same thing basically with your brain. They put a patch, normally it's synthetic, which means it could be like made out of bovine or other
Bovine, porcine.
Yep, pig, everything, weird things like that.
They don't use mesh, right?
They're not supposed to. For me, they did, but I guess that's
come on.
controversial.
Okay, well,
I know.
Okay. So we're still gonna get into all your story, but the general approach is that
Less
they can
is
use.
more.
Okay.
Yes, basically they can do what they want. So there's no standard. This isn't like your typical surgery, hip surgery or carpal tunnel surgery. There's so many ways of doing it because it's rare. Not many people know about it. And in my opinion, because it is rare, these surgeons get away with almost treating you like a guinea pig.
I want to look this up on Facebook. I'm just going to do a quick Google real quick, live on the podcast for Chiari Malformation, and see how many people as a whole are in some of these groups. Okay, we have one group with 40,000 members, one group with 5,000, a group with 15,000, a group with 24,000, a group with 10,000. So not entirely super rare, but definitely fringe for like Tarlot's disease. Lipedema is becoming a bigger thing, but yeah.
I've noticed that lipedema is becoming more known.
Because so many people with EDS have it, and so many people with connective tissue diseases have it. And as we all network together, it's, oh, what's that? Oh, I have that. But
this is what happens. We all talk, and we become almost like doctors. Not to downplay that, but in a sense,
oh, it's true. We have to become our own doctors because there's so few specialists and so few doctors that are talking about this in the public and in the media. And until we create awareness, it's generally not there.
Exactly.
Okay, so let's go back to your surgery. So you find the surgeon, he's in New York, you sign up for the surgery that's supposed to be minimally invasive, and it winds up not being minimally invasive, and you just woke up to that fact?
Exactly. I woke up to actually waking up, I felt great. It wasn't until a few weeks after where I realized like something's not right. So at this time, I still have no idea what type of surgery I had. He barely went over anything with me. He went over a little with my husband, but I'm finding out 3 weeks later by asking for my operative report that there was a lot that went on. It was 4 pages. This was before ChatGPT, so I don't know anything that's in here.
Okay, can you go back and recap what was in that report? Are you able to do that?
I can a little bit. It basically said I had a leak really bad. So the report says that they have to patch up this leak and they just have to do a bunch of stuff. They put the bovine, the cow there, which is a medical device or implant in itself that you can have issues from. They did fibrin glue.
Oh,
and then I see something.
You can have issues from all of that stuff. And were you consented for any of that before surgery or just under the standard of care like everything else? General consent. Okay. Consent. So you weren't tested for mammal allergies. No. You weren't asked about that. You weren't asked about. Okay. All right. So they've used bovine, they've used fibrin glue, and they also used metal, correct?
Yep.
And can you say where they use the metal and why?
So the why I never really found out for sure because everyone had their own theory. The surgeon that did it downplayed it. He was like, "Oh no, it's small." So now I'm thinking this is like clip, even though we know clips can be a problem.
Yes.
He said it was something like that. It wasn't until way later.
Hang on. So he said they used it. Where did they use it and why? So obviously in your brain.
I ended up finding out later that they put it there so that the muscle can reattach.
Like some kind of a tendon anchor, muscle anchor.
It's supposed to prevent scar tissue, which is ironic because that's not what
what part of your brain did they put that in? Is it like right there at the opening at the hole? Or how far up into your brain do they go with this surgery?
No, it's down here. So it is at the bottom where the actual malformation is. The very bottom of your brain, they do all this there. It's that cerebellum tonsil area. And that's where this mesh was.
Was this polypropylene mesh?
No, it was titanium. It was supposed to be pure titanium.
Oh, so this is the metal that they put in your brain. It was a mesh.
It's to cover the hole that he made for expanding my brain.
And going back, you weren't asked about metal allergies prior. You weren't consented for metal allergies, metal specific. Are you allergic or did you just have problems with the metal?
I'm allergic.
Had you had problems in the past with earrings and allergies to metal?
Yeah. Nickel.
Okay.
Yeah.
Did you know that? Did you know you were allergic to nickel before the surgery?
Yes.
And
Yeah.
did you
And I
ever tell
also
the surgeon?
knew on my file, it said I had not nickel allergy, but the contrast dye, the iodine, which is, I guess, also a form of metal.
It would be
some kind of-
gadolinium, not iodine. The MRI contrast is gadolinium, which is a metal agent. The CT contrast is
Okay. Yeah.
iodine. So it would be the
Okay.
MRI agent is metal.
So it was actually the gadolinium I had reactions to, but the iodine I was allergic. Like that was on file.
Interesting. So
Everyone
you have
knew.
reactions to most of the contrast media.
Yeah.
And they knew
Yeah.
that ahead of surgery.
They did.
So aside from like earring symptoms and just contact allergies, did you have any other symptoms from your metal allergy that you were aware of prior to your surgery?
No, just reactions like I would get redness. My skin would change color, like turn like a green kind of color from it. Actually, one time my earring closed up. The back of my earring got closed into my ear, like the lobe completely closed over. They had to do like surgery to take it out. Obviously, I knew all this, but it was on my file that I did have problems with like iodine and jewelry. Just nothing said metal. It was never even something that I would think would ever be an issue. Like I just never thought. I thought when metal's put in your body, you have a very long conversation about it. So never would I think that these things could happen.
Yeah. Did you find out that you had the metal before you started having symptoms, or is that why you went looking for your op report?
No, I just wanted to know what went on. I was surprised to see this metal. It was downplayed for a very long time. It wasn't until way later, like a year and a half later, that I actually found out that there was an actual like implant, like a device. So we're jumping now a year and a half later. I see another neurosurgeon and he's breaking it down and he's telling me something does not look right. It looks funky. It is not happy in there. There's a lot of scar tissue. I had to learn on my own because my neurosurgeon just completely dismissed me and actually just ignored me.
I'm so
Straight up
sorry that
ignored me.
happened. Were you having symptoms at that point, a year and a half
Yeah.
later, when you're seeing the second neurosurgeon? And
Yeah.
are those the symptoms you talked about in the beginning?
After the surgery, like I said, I felt great for about 3 weeks and then I could not turn my neck. I was like a robot and just getting a lot of severe neck pain, sharp. I kept saying, I can feel something. So it wasn't until way later, this other neurosurgeon, that they had said, that's all scar tissue. So now I'm just really being told you have a lot of angry scar tissue in there. And although scar tissue is normal after surgery, like way too much, like we need to go in there and do the removal. So now I'm getting worked up for a second surgery.
So you haven't had that yet, but the plan is they're going to go in and remove that mesh completely?
Yeah, at this point, this second neurosurgeon I had seen, that was the plan. He dropped out right before my surgery. We were on the books. So I was getting worked up. He decided it was going to be too risky at the very last minute, and I never understood why. And then I couldn't find where that neurosurgeon went. I still don't know where he went. So I went through a lot of just PTSD from that because I knew something was wrong. He told me something did not look right. He told me, yeah, you need surgery. It wasn't done right. We need to go in there and take all that out. And now he drops out and I can't find him. So then I'm going down the whole rabbit hole and trying to figure out what do I do now. And I get to a point where I don't even want to deal with it. And family things happen. I'm still in a lot of pain. I would feel like burning pain there and everything. When I would get an MRI, MRIs would just totally bring out more pain. I knew I would say something's going on with these MRIs. I don't know why I get so much pain. When I'm laying there, it's burning. Like I feel something. And they were just, no, it's titanium. It's a nerve. No, it's not that.
And now, a word from our sponsor. Attention metalheads. Are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses.
Get to the root of the problem with ELISA testing. ELISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit melisa.org to learn more and schedule your test. Trust us, you'll be glad you did. ELISA, a valuable diagnostic tool in medicine.
It was about 4 years after the initial surgery, about 3 years after they started telling me something didn't look right. And COVID happened. This neurosurgeon was great. He also said something does not look right. He's doing bone scans, CT scans, and he's telling me, like, I can see the screw has a halo. That means something's wrong with the screw. It's like it's breaking off, or your mesh looks like it's breaking apart. We really need to go in there. And COVID happened. So I can't do brain surgery. During this pandemic, I didn't have COVID yet. It was so scary. They told me I couldn't have anyone in the room with me or even at the hospital. I'm like, I'm not doing that. So now I put it off. My family and I move. And now this is about 5.5 years later. I'm ready to tackle it again. And I'm the worst I've ever been in my life. I could do the bare minimum. I was bedridden. I would go to work, but I would just that's all I could do. But when I moved down here to North Carolina, I start over, whole new system. We are lucky to be around the best of the best. We have Duke, we have UNC, top hospitals around here. And long story short, I was blown off by this next neurosurgeon. He's telling me, it looks fine, nothing looks wrong. Now I'm doing more research on my own. What about an allergy? I'm actually Googling things about the device.
I was going to ask you, what led you to a metal allergy?
Just desperate. Was just looking up everything I possibly could about my surgery, about what they found after my surgery. And I'm seeing these symptoms are correlated with, it could be metal allergy. It's titanium, but I'm seeing people say that they have reactions to it. And this neurosurgeon is blowing me off. He didn't want to entertain it. So I go on my own. I'm like desperate. I contact the manufacturer because I'm finally getting all my records from the first hospital, and I'm seeing they actually have a model number and everything like that. So I am contacting the manufacturer. And I happened to get some poor guy that probably shouldn't have told me what he told me, but he told me everything. He emailed me things I know he wasn't supposed to email me.
Explain. Can you elaborate? You won't name the guy, but just tell me what he told you.
No, I know. I feel so bad, the poor guy. But he's telling me, no, it's not pure titanium. They don't have to say, if it's over 90% titanium, they can say it's only titanium. But your specific model has vanadium, has iron, has aluminum.
You want iron and aluminum in your brain.
Yeah, I know. Crazy. I'm validated, right? I knew something. So now I know. So then I go back to the neurosurgeon who's blowing me off with this information. And I guess we can do something if you're really allergic to it, or if you're having a reaction. I'll entertain it. You can get some testing. So they send me to an allergist. I did the ELISA test. That came back. I had a reaction to nickel, which they knew was in. Once I contacted the manufacturer, we had some nickel in there, which I find out later, a lot of these devices have nickel, even when they don't say it.
Well, yeah, the FDA doesn't require trace nickel. For those just tuning in who aren't in the know, surgical clips, staples, any of that pure, inert surgical titanium hardware, it's an alloy. There's no such thing as commercially pure titanium. And just a little PSA, the trace amounts of nickel, vanadium, aluminum, other alloys can make you super, super sick. Do you remember what the percentage of nickel was in your mesh? What is it?
Yes, not nickel. The nickel, they said trace.
Okay.
But it's like TIVAI.
It's titanium, 6% aluminum, 4% vanadium.
Yeah. And trace of other metals.
What your ELISA test, how reactive were you on the scale?
Well, I think 3 is when it shows. I was mild.
Were you allergic to any other metals?
The ELISA test, no. But when they did the skin patch test, I was reactive to titanium and vanadium.
You've got to be one of the only people I know who reacted to titanium on a patch test.
So she said reactive, not allergic. She said it was an irritant.
Okay.
So she also downplayed it. But I was like, I want that in my chart because are you telling me that I had some kind of reaction? And she's, yes. I'm like, I don't want that in there
Yeah.
because that very well could be an allergy. I literally would fight with this doctor. She didn't want to put it in there and I made her. Yeah.
Wow. Is the Eliza and the patch test the only testing you've had, or did you get to ever do orthopedic analysis as well?
I
Just really?
didn't. I wanted to.
We're not made of money, all of us.
I know. That's what it was. I'm like, all right, I think I have enough to be comfortable. This
Sure.
thing needs to get out right tomorrow.
And when you
At
showed
this
it to your
point,
doctor, what did he say?
he was like, it's fine. It's a very small amount. That doesn't necessarily mean you're allergic, things like that.
Okay.
So I stopped playing with that neurosurgeon at that point. Then I was getting like serious, right? I'm like, I'm finding somebody. So I found another neurosurgeon in the same hospital, but this neurosurgeon knew more about these things with devices and things like that. So I go to him, does the whole workup and everything. He does surgery. He takes it out. And when I'm finally aware of my surgery, like what happened, my husband's, wow, yeah, he said it was broken apart. It was in bad condition. It was really bad. You were right. And I'm like, I knew I was right. I felt it. Unfortunately, he never admitted again that he said that, but he did tell me, even though I was out of it. And he did tell my husband. My husband actually recorded the conversation when he came out after surgery, and I just found it recently. He absolutely said it.
Wow.
He just never admitted it again for whatever reason.
The liability.
Yeah, exactly. They don't want to hit the hand that feeds them, or that expression. Like these medical device companies give these hospitals a lot of money.
It's absolutely criminal. I have all these thoughts in my head that I want to ask you and I don't want to forget them. But yeah, medical device industry is massively huge and bought and paid for, and we're victims of a lot of that, unfortunately. So you found this new doctor. You found a doctor that's willing to do the surgery to remove the mesh?
Yeah, he was the one that I finally found. He's also a Chiari specialist, but he did imaging. And this was after I was like here in your face. And I think that's when this hospital started taking me more serious, and whatever they do behind the scenes, the chatter, the whatever I feel like goes on when you watch these medical dramas, you see all this, they disagree with each other. So he was willing to take it out. He's, yep, I know something's going on. He didn't really want to entertain what the paper said, that I was having an allergy and a reaction. He was just like, we'll go in there and take it out anyway. I don't like what I see. But I'm like, really? I love this neurosurgeon, but I don't know. It just seemed weird now all of a sudden.
You're going to get to be a trendsetter, because when he takes it out and your symptoms go away and you go back and tell him, hopefully the hope is that he will believe that. And maybe you introduce him to Scott Schroeder's little 9-minute video to the FDA device panel meeting. And most surgeons will watch a 9-minute video. It's not too long. What state is he located in?
He's in North Carolina.
Okay, so he's
with the Duke Hospital facility, and he's amazing. I don't follow him at all. I don't know exactly. It could just be my conspiracy brain, but I do believe there was a lot more. They just didn't want to tell me because they don't want to go against losing money and all that and get involved in lawsuits and things. And I get it.
Has he removed mesh from the brain before?
It sounds crazy. I was so desperate. He didn't tell me he did, and he didn't tell me he didn't.
It doesn't sound crazy. We've probably all been there to one degree or another. Might be a conversation worth having, right?
Yeah. Yeah. It's almost like I'm afraid to have these conversations with him because I don't want to scare him. Probably understand
That's really
that
understandable too. But it's hard when you get a little glimmer of hope. Here you've suffered all these years and you finally find a surgeon who's willing to take out the thing that's the thing. And if they get scared and run, like we had a doctor that bailed over something like that, got scared and ran. And there's a lot of patients who don't get to benefit from the metal he would have removed because he got scared and ran. Got spooked. That's what happens to these pioneers that step out on a ledge to help people. Some of them get spooked. Yeah, so I can understand where you're coming from. That would be really difficult. What have you done to improve your symptoms? Did you find out about a low nickel diet? Have you gone to a low nickel diet? Do you treat with antihistamines, immunosuppressants? What's worked for you, and has it worked?
My body just needed some time to readjust. I still deal with stuff. Your podcast with Dr. Schroeder, actually, when he talked about Him and the lady from Melissa,
Mhm.
Linda, yeah. They had mentioned to look into the diets and the cleanses and things like that that I can do. And I have to put more time to do
So
that
you haven't
because I
really gone there
know.
yet. Let me tell you something really cool. This was for those who didn't hear our last podcast episode that was the season 3 opener. Dr. Schroeder and Linda Nelson were on, and Jolene was a podcast guest, and she talked about a knee replacement that she's allergic to, but she went on a low nickel diet and is off all of her pain medication, all of it. Can now walk, can now function just from that change in diet. Yeah, Jen, I would encourage you and anybody else who hasn't realized just how big a thing that can be. Like for me, it's still really important. And I have a lot of people that message the podcast like crazy during the spring and fall when there's more pollen in the air and their pain ticks up. They're like, man, I don't know what's wrong, but I can't move. And I'm like, there's a lot of pollen in the air where you are. You've got an allergic reaction happening in your body and you just got your histamine load added to. And they're like, oh my gosh, I didn't even think of that. So all of these contributors, outdoor pollen, that's what I found because I'm extremely sensitive and they say I'm a medical anomaly. Not so much because I hear this from my listeners all the time, but that pollen load in what you eat and in the air outside can make such a difference. And I know that literally one of my guests was able to go from not eating and like withering away. He was so thin to eating again because he started taking antihistamines and H1 and H2 blockers, and it masked so many of his symptoms that his life was worth living again. So some of these therapies can be really important for you, especially clearing brain fog. Like they really do work for me.
Yeah.
And I
That's
don't,
where I need help.
yeah, these are simple changes that are free that you can do from home.
Yeah.
Obviously consult with your doctor, not a medical advice podcast,
No, I know.
but that's
Yeah.
what worked for me. And it's worked for many people I know is even if the allergist or the doctor you go into doesn't necessarily buy the metal allergy thing, maybe you can just like your surgeon. It sucks to say, just get them to indulge you. But I've got a really great doctor who's, look, if it's not going to hurt you, I'm okay if you try it. And those are the kind of doctors we need because when you can go home and try it and pain has gone from a 10 to a 7, or 10 to a
Yeah.
6, or in Jolene's case, a 10 to a, I don't need pain medication anymore. Things like low dose naltrexone can help a lot of people. That's a non-narcotic, non-addictive pain medication that works on the
Yeah.
opioid receptor sites. It's $30 a month. It's not addictive and it can really take the edge off a lot of pain and it helps modulate the immune system. There's a ton of clinical research behind it. So that's a really cool thing.
I've heard of that. Yeah. I take Lyrica. It definitely helps. I take it at night. I feel like that was a game changer for me, but I still definitely need help with brain fog and concentration. That just helps with pain and it helps me sleep. But I will definitely get more serious with my diet and histamine and all that.
I would say, oh my gosh, just from my own personal experience, I would tell anybody don't walk, run.
Yeah,
It's that good. It takes a couple
definitely.
months to start to really see the difference. Some people have seen it earlier, but after you've been on a low
Mhm.
nickel diet for a couple months, if you're nickel allergic, oh my gosh, it's such a game changer. And you didn't
Yeah.
show allergic to cobalt, right? Because some of the
No.
high nickel foods and cobalt foods overlap. So some of these people that have cobalt and nickel allergies, I need to do an episode on cobalt allergy sometime soon
Yeah.
because they're very comorbid too.
Really? Wow. And cobalt
So
is like the hip, right?
hip and knees, not
Yeah.
all hardware, but some hardware is more common there.
Okay.
And in some older spinal hardware, it's there too.
So that's probably why they're not really too excited about
But
saying,
you
yeah,
have
this
no
mesh, just
metal
look at
left
it.
inside there, right?
No metal. No metal.
And what
They took it
symptoms
out.
did you notice resolve when they took that out?
Oh, the pain, the pressure, burning pain that I had there. My mobility got better. I was able to move my neck more, and it took time. And I had to work on stuff on my own.
Sure.
But
You've been like
that
frozen in time
pain,
for a few years. How long had the metal been in?
it was in there from 2016 to 2023.
Wow. Okay.
Yeah.
Long time. Was your symptom relief immediate when you woke up?
It's hard to tell because I had a bunch of brain surgery complications. But once I started recovering about 2, 3 months later, I knew I'm like, I didn't feel the pressure almost immediately, but I was still getting a lot of pain. But
Mhm.
once I recovered, I knew I didn't feel it anymore almost immediately because I
Fantastic.
felt like something, when you have something in your throat, it was like something, that feeling with pain, with burning, with pressure. So that was gone.
Girl, I'm wondering if you take the nickel out of your diet, how much of your brain fog is going to go away just like that. I'm really wondering. I
too.
can't wait for
I'm
you to
gonna do it. No,
I can't wait for you to
absolutely.
try some of that and the
Hmm.
antihistamines and the Pepsid is an H2 blocker that a lot of people with nickel can handle the Pepsid AC and
Huh,
I take it
okay.
twice a day and gosh, I can't almost function
Wow.
without it. It's not about stomach trouble. It's about my symptoms.
That's amazing. I would love
Yeah,
that.
isn't that crazy? I know.
Yeah, I
And
still have like
gosh,
the
like you could do that this
dizziness.
weekend,
And
girl. Check with your
I
doctor, but you could do
really,
that this weekend. You may be feeling better.
I'm gonna
Next
start
week, you're going to
tonight.
call me before I can even air the podcast. You're going to, can I come on and do a follow up?
I know. Oh my God. Yeah, I believe in that stuff. I'm a believer. Like you have to get away from regular medicine. Gotta be your own advocate. And I believe in taking charge of your own health by doing things that only you can do with your own research and your own advocacy. Because if nothing else, that this whole experience taught me was that you don't give up when you know something's wrong and someone's going to tell you and help you.
Yeah.
Take their hand, do it. Because what harm is it going to do? If I do this nickel diet, what's it going to do to me? Nothing. It's going to
Right.
not hurt me.
No, it's
I'm
definitely
all
not going to
for
hurt
that.
you. Is it commonplace to use metal in the Chiari surgeries, or do you think it's rare?
No, it's not super uncommon, but it's not common.
Okay.
I found a few people and we all have the same story and we all
Well,
talk about the same pain and we all talk about the same theory that it's not only doing things in there because it's maybe breaking apart or whatever, but like we all know like our body's rejecting it. And the
mm-hmm.
whole like not looking right on scans and the suspicion of it like breaking apart or coming apart that I was being told by other, I would be told by one surgeon and then be told it wasn't. But what they saw, what they thought they saw before they went in there, I believe is my body was rejecting it.
Of
My
course.
body was like, get this thing
Yeah.
out of me. And I do have an autoimmune disorder now because I think it was in there too long. Like my
The
blood's all
thyroid?
funky. It's just undifferentiated connective tissue.
Okay.
They don't want to say it's lupus, but it shows like it could be lupus.
That's
And
so weird. I got to figure out. I don't know who the person is that's going to make the connection, but I know
mhm.
so many people with metal allergies, systemic metal allergies confirmed by blood tests that show lupus markers. I show lupus markers
Really,
and I don't
really,
feel like I have lupus. Oh yeah, absolutely. And I
yeah,
can't tell you how many people are told they have lupus and I don't
yeah.
personally, I don't think it's lupus. I think it's a metal allergy, and there's some
Mhm.
common link with with lupus markers. And I can't wait for the research that'll tell us what that is. Maybe I should ask
I'm with
ChatGPT.
you. I was gonna say do that because I'm telling you, they pull from a million different websites that you
Although
be
I
even
will tell you that I've been
compiling.
using ChatGPT to help plan my Greek vacation that I'm leaving on next week, and I can't tell you how many things it got wrong. Over and over when I said, hey, you got that wrong. Hey, you left this out. Hey, you left that out. Hey, you said it was half a mile here, but a quarter mile here. Hey, you said I needed 15 minutes here, but I need an hour and a half. What?
Yeah, that's
Ugh.
hard. It's
Double check your
frustrating.
Chat GPT, y'all.
Yes, I think ChatGPT is not 100% for. It's gonna take some years for it to be like you can trust it fully
But I'll
though.
just
But
tell you
I
a
use
funny
it.
haha. This is like a little bit of a deviation, but the video editing software that I will remain nameless just so I don't, because I don't want them to chase me down. They have a new
Hmm.
AI tool to help with video editing, and it's called Underlord.
Huh, that's weird.
Underlord. I'm not using a platform with an AI tool named Underlord. That feels like I'm serving the dark side, y'all. I am exiting
Yes.
that platform like yesterday. I got to find a replacement, but I'm out. I'm not serving
Hmm.
no Underlord. Just to be clear,
No.
I know I like rock and roll. I know there's that whole thing.
Yeah.
Don't serve the Underlord.
No,
Jiminy
I'm with you.
Christmas. Yeah, not okay.
Yes,
They like wrote
no.
back, it doesn't have any satanic connotations. I'm like, yeah,
Yeah,
really?
sure. Doesn't sound like
I
it.
got one Lord and he's not on.
No, it's a bad name.
Yeah, I just
That's
can't.
funny.
Even if it's completely innocent, I just can't.
Yeah.
Yeah,
I-
that's crazy. I'm really glad that you came on to share with the community. I'm grateful. I did have a follow-up question. Did your surgeon, and I'll put this back where it belongs.
Okay.
Did your
Sure.
surgeon, when you went, proved to him that you had the metal allergy test, he removed the mesh and you went back and told him about the symptom resolution? Did he finally get it or still not?
Still didn't really want to. We just didn't speak about it. That was it. I asked him, I said, hey, what's up with this? And he was like, yeah, we took it out. It was fine.
It's fine.
Yeah. And I was like, I don't want to piss him off and keep asking. He doesn't want to go there. So we're just going to leave it maybe in the future, but we're not there yet. And I really could confront him again. And I think now that I feel like I don't really necessarily need him because he cleared me only like a month or two ago.
Yeah.
He'd probably now I'd be like, okay, you just tell me the truth here. But I just like him so much. I don't even want to put him in that situation.
Hey, Doc, I just did a podcast. We talked about you. We didn't say your name, but we talked about you here. You can watch this.
Yeah, no. He knows how I feel about him. He knows I'm not happy with the first guy in his hospital that dismissed me. And that neurosurgeon also knows I'm not very happy with him. But
you know what? He may not buy the metal allergy thing today. Mm-hmm. Mad props for being willing to take out your mesh. How hard can that be to remove metal mesh from the brain? Yeah,
it was bad. He said it.
I'm so sorry that you.
He looked like he was so stressed when he talked about it. He was like, "We don't want to go back in there." He's like, "That you were trouble. You were trouble."
How long was the surgery?
I think it was only like 5 hours, but
only 5 hours,
no, brain surgery. That's not too bad. But
okay.
And then the complications after. He stuck by my side. Thank goodness. And I really do feel like it's all because of this thing. If this thing was never put in me, I wouldn't have had 2 surgeries. But I'm just so thankful that I know the truth, and that's all that matters. So,
where are the best places that somebody with Chiari malformation can go to get information?
So there is Conquer Chiari, and there is a CSF leak. You might know about this with CSF issues. CSF Foundation, Bobby Jones.
Are these websites or these Facebook groups?
These are websites. Those are just, I don't know the exact website, but if you Google those terms, Conquer Chiari, CSF, Bobby Jones, Facebook, honestly, I know that we can't always just rely on what you hear on these groups, but use them as a tool.
Yeah,
definitely.
But great support from people, like so much
support.
Yeah. Like you feel like you're not alone. Like when I know that I have this weird symptom and somebody with my same thing has that weird symptom too, there's just a certain camaraderie in that, right?
There is,
When you're chronically ill, you need, or I shouldn't say ill, but when you're in a chronic recovery, because I like to choose to frame that in a more positive light, you definitely need reasons to keep moving forward and a reason to wake up the next day. And these people, I know for me in some of the Facebook groups, they really gave that to me. So
yeah, they do. They really do. And always if someone tells me, oh, don't go on groups, they're bad for you. I'm like, you know what? That's how you feel, but I don't know where I would be without them.
Yeah.
I'm very thankful.
I've made some lifelong friends on a lot of these Facebook groups, and it's for good and for bad.
Yeah.
I really appreciate you coming on today to share your story. We're gonna wrap up, but you have any famous last words? Anything you want to leave anybody with?
That it's not in your head, no pun intended. It was in my head, but it's not. If you feel like something's wrong, don't.
It was in your brain, girl. It wasn't in your head. It was in your brain.
It was technically in my head, but yeah, it's not in your head. Fight, just never give up. So
the title for the Chiari episode, Chiari Malformation. It might be in your brain.
It might be in your head, but it's not.
I hope nobody else with Chiari has to go through this, but if they can find the Facebook groups and Conquer Chiari and the right resources, then hopefully they never have to go here. You being willing to share your story is super, super helpful, and I'm sure we'll raise a lot of eyebrows. And I just thank you for being courageous enough. Took us a minute to get together, but thank you for being courageous enough to come on and share on behalf of my community and your community. And I'm going to go ahead and end our traditional way by urging people to sign the petition to help screen for metal hypersensitivity. It's up on the website, and to make sure you share that with your healthcare providers, medical facilities, so we can get people screened for metal hypersensitivity, and share this podcast, forward it to people who you think might benefit from the information. And as always, join our community and help us continue to be part of the movement that tells the medical community that we're not going to take it anymore.
I love it.
Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware, and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetal.com, where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.